This is part 7 of dental caries. Now we are seeing today is what are the different etiologies of dental caries. So let's start then. So you can see here are the two diagrams you are seeing, that is Caries diagram and the Venn diagram of this caries etiology. So you can see in Caries diagram it is saying that cariogenic plaque bacteria susceptible host and this high sugar diet leads to progression of caries. And according to the Venn diagram, here there is a host factor, substitute or the substrate or the microbial flora, and these three together will lead to caries, and also saliva also play a very important role. So now let us see the etiological factors. So there are two types, that is primary factors and the secondary factors. So primary factors involve teeth, diet and microorganisms, while secondary factors involve saliva, other dietary factors, vitamins and minerals, and hereditary factors. So these are the different etiological factors. Let's first see about primary factors, that is teeth. So first is teeth. So teeth factor is also depend upon morphology of teeth, position of teeth and the composition of the teeth. So we will see it one by one. First is morphology. So morphological things are accentuated pit and fissure. So if there is a pit and fissure present, so here the chances of caries will be high. If there will be enamel hypoplasia, then also there will be all this pit formation, that again leads to caries formation. Mottled enamel again has high chances of caries formation, and also buccolingual width of the caries. Now when we talk about position, so malpositioned teeth has high chances of caries formation. Rotated teeth also has a high chance. So as the teeth is rotated, so there will be formation of gap between the teeth, which can lead to again caries formation. Now let us see composition. So composition is are of a two type, that is surface composition and the subsurface enamel composition. So you can see these all are the elements that are present in a highest concentration on the surface. So these are fluoride, zinc, lead and iron. So these are the constituent with the highest concentration, and their concentration usually decreases from surface to dj. So it decreases from surface to dj. That's why you can see that here this cone or the triangle has formed where the apex is toward the dj. That means it will going to decrease from surface to dentine. And you can see these all are the ingredients or the constituent where concentration is seen more towards the dej or the dentine. So these are H2O, CO3, Mg and sodium. So these are the constituents with lowest surface concentration. So they usually increases from surface towards the dej. So these are the constitution which are present on the surface and subsurface enamel. Now let us see the diet factor. So diet play a very important role in caries formation. So you can see carbohydrate is a cariogenic diet. So cariogenicity is based on the physical nature of the food, how you are taking, as it is sticky in nature or it is very much like liquidy in nature, and the chemical nature, what constitution it is present. Mode of intake, how you are taking it, in a liquid form or in a solid form, or the clearance rate, how it is clear easily. Means if like liquid food will clear off easily from the occlusal surfaces, while the sticky foods like chocolates adhere to it for a more period of time, so it will lead to more caries. And also on the frequency of intake, how many times in a day we are taking a food. Other dietary factors can also contribute. So this was the dietary factor which contributes to caries formation. Now let us see the plaque and microorganism factors. So the concept of plaque is introduced by Williams in 1897. So what is plaque and what are the different constituents of the plaque? So it is consist of usually salivary component like mucin, desquamated epithelial cells, microorganisms, calcium and phosphates. So these are the usual constituents of the plaque. So now let us see what all are the different properties microorganisms should have to produce the caries. So microorganisms should be acidogenic, that is it can able to produce acid. It can be acidic, means it can able to survive on the acidic environment. Should possess the attachment mechanism, that is it is able to attach on the plaque surface to produce more acidic environment. Should have capacity to store sucrose. should be able to synthesize extracellular glucans. So these are the different properties microorganisms should have to produce caries. Now let us see what is pioneer and the primary bacteria. So what is pioneer bacteria? So it is the bacteria which initiate the caries formation. So usually S mutans is the pioneer bacteria or the primary bacteria in case of smooth surface caries, while Lactobacillus acidophilus is the primary bacteria or initiative bacteria in case of pit and fissure caries. And when we talk about root surface caries, so actinomycosis is the main initiating bacteria. So these three of them is nothing but the MCQ question, that which bacteria involves which caries progression, and very important, it is actinomycosis is involved in root surface caries. And other type of bacteria are invader bacteria or the secondary bacteria. These bacteria will proceed further after initiation of caries, that is our Staphylococcus and Veillonella. So these are the secondary bacteria. Now let us see in detail about Streptococcus mutans, because it is one of the most important carious bacteria which is involved in caries formation. So let us see. It is a chief etiological agent in the dental caries. So let us see why this Streptococcus mutans is one of the most important organism in dental caries formation. So the reasons are, first of all, it can able to produce the low pH, that is it is acidogenic in nature. It can able to survive in low pH, that is it is acidic in nature. It utilizes sucrose at a faster rate than other bacteria. It can metabolize sucrose to synthesis glucan and fructan. So these are help in attachment mechanism of this Streptococcus mutans to the plaque. It can store intercellular glycogen amylopectin type polysaccharides that act as a reservoir of substrate and prolongs its metabolic activities. So these all are the reason why this Streptococcus mutans is one of the most and the chief etiological agent present in dental caries. Now let us see other bacteria that are involved in dental caries, that is Lactobacillus acidophilus. So it is found in Caries dentine, saliva of the persons with high caries activity. So it is seen in them, release lactic acid. While the other organism is Actinomyces, it is found specially in root caries. It is acidogenic. It attaches to the tooth by glycoprotein called as an lectin. So these are the other organism. Now let us see what are the different acids produced by these microorganisms. These are usually lactic acid, acetic acid, butyric acid, propionic acid, and traces of formic acid. Lactic acid is the strongest acid. One of the most important acid produces this lactic acid. So you have to remember that. So now let us see pH factor. pH is also play a very important role in formation of caries. So the critical pH of the mouth is 5.5. If it is get below than that of the 5.5, that means caries progression has started. If the pH will be 7 to 5.5, there will be no caries formation. If it is get below this 5.5, there will be caries formation. That's why this 5.5 is considered as critical pH. So the caries active individual has pH between 5 to 5.5, that is below the 5. Caries immune patient has pH usually 6.8 to 7, that is near to the neutral pH. So there will be no caries formation in caries immune individual. So you can see this is the Stephenson curve of pH. So you can see, let me zoom it. So you can see initial pH of caries immune patient is around 7 initially, and when it takes the glucose, then it become around 5.5 after around 10 minutes, and after 10 minutes this pH is again started to increase till the 1 hour, and the pH is get back normal to that is neutral pH within 1 hour. So in case of a caries susceptible patient, the normal pH is around 6.5, and if such person will going to take glucose, it will get to below the 5.5 pH within 10 minutes, and that is below the critical pH, and after that it will started to get increase within the 1 hour, it will get back to 6.5 again. So in case of a caries susceptible patient, the pH is dropped below the critical point when there is glucose intake. So here in caries susceptible patient, there is progression of caries will be very fast as compared to the caries immune patient. So now let us see the minor factors, that is saliva. First is saliva. So the salivary factor is depend upon flow rate, viscosity of saliva, buffer capacity of saliva and amount of saliva produced. While component of saliva is also play an important role, that is how much amount of bicarbonate is present, how much amount of antibacterial agent is present, how much IgA is present and how much salivary urease and bicarbonate is present. So it is also depend upon the components of saliva as well. So now let us see the dietary factors. So dietary factors, when we talk about, so if we have a phosphate diet, it will decrease the caries formation. If we will have protein or fat diet, it will also prevent the caries formation. But if we take a vanadium and molybdenum, it will also decrease the caries formation. But when we talk about the selenium, it will going to increase risk of caries. When we talk about vitamin A and B deficiency, so it will going to increase the caries formation. If we talk about the fibrous food, it will decrease the caries formation. Why? Because fibrous food help in cleaning the teeth and remove the lodged food, and also there is hereditary factors can also involved. So today we have seen different etiologies of dental caries, what are the major factors that involve in dental caries and what are the minor factors that involve in dental caries.